My name is Villalobos. I'm a neurosurgeon trained at State University of New York and University of Miami. A neurosurgeon is that surgeon that is trained for 5 to 8 years on treatments of the nervous system, the spine, the spinal problems, complex spine surgery, minimal invasive spinal and brain surgery.
This patient has had back pain for a couple of months and experiencing leg pain.
Okay, do we have the films today?
Yes, I have them right here.
Thank you.
You're welcome.
Every member of our team goal is to provide the best level of care of our patients in terms of communications and quality and results. If the non-surgical treatments don't work, surgery could be an option here. Okay. Coflex or internominal stabilization is a device with great success outside of the country in Europe and South America that provides simultaneously stabilization and decompression of lumbar segments. What does that mean? It's like it provides a solution of the pressure on the nerve, but at the same time it stabilizes the segment in maintaining the mobility. It's a pretty clever idea and fairly effective for patients. The fusion obviously immobilizes the segment. In other words, we had to put screws and rods to immobilize the segment. Obviously, the patient had to be a candidate for that operation, but once you implant the Coflex, the patient's mobility is going to be similar or better than prior to surgery. In a fusion, what we do, and after the decompression, people with severe stenosis, we had to remove portion of the vertebrae that make them unstable. We mobilize by inserting screws and rods. And then bone graft is inserted on the sides of the vertebrae. If we perform an interbody fusion, we remove the disc and a cage wet bone graft is inserted. Obviously, this segment loses mobility and the segment above and below have risk of degeneration that is significant. So in patients with spinal stenosis where a foraminotomy or a small decompression is possible, then we try to maintain the mobility so patients can go back to normal life rapidly. And this new device called the Coflex, which is an interlaminar device, provides a stabilization that maintains the mobility. So for it's called a dynamic stabilization, yet performing a decompression directly with a minimal invasive approach. So when we do a cervical fusion, patients are usually severe spondylosis and stenosis, we had to remove portions of the end plate of the vertebrae that become a spur. And in those cases, we insert a spacer in between the two vertebrae. And the majority of times, we insert a plate with 4 screws to provide immediate stabilization. This obviously eliminates the mobility of this segment, and the levels above and below have a 5 to 10% risk of degenerate in the future. To avoid that, in those patients that have only this herniation with no spondylosis that is severe, we would like to prevent that process and provide them with the ability to continue moving their neck. In that scenario, we have the option to use a disc replacement or arthroplasty. In this case, this is called the Movi-C, and this is FDA approved for 2 levels and allowed all access of mobility on the patient after surgery. Patients are able to return to normal life fast in a fusion because one is because it's a much less invasive procedure, and 2 is because the mobility is present. When you do a fusion, once you put the hardware and the graft, your body has to create the fusion, build bone that may take months. With the Coflex device, that's not an expected part of the process. You simply perform the decompression, insert the device, and at that point, the patient is ready to go and move.